Hi Ian, today we will be reviewing your oral hygiene education. So currently your oral hygiene regimen consists of brushing twice a day, using an electronic toothbrush, not flossing, toothpaste is crusted with fluoride, and mouthwash is Listerine 4 times weekly. So Ian, in looking at your oral hygiene habits with you, and the things that we've gone over in clinic, I would place you at the self-interest stage on the learning ladder. You are aware of what to do, and you're willing to try and improve upon what you have already. This should help you create a habit, which is a new behavior that are practiced over a period of time, and a lifestyle change occurs. You can do this. First, though, I'd like to explain a few things to help you understand why it is important to maintain good oral habits. Like, what is plaque biofilm? Well, plaque biofilm presents itself as a soft and sticky film of bacteria that forms on the teeth, as you can see here with the teeth that are stained purple. Biofilm can also contribute to cavity formation by protecting the bacteria living within its structure so that they can survive and thrive. This definitely breeds cavities. If the biofilm goes undisrupted, it will eventually cause damage to your teeth and gum tissues. Which brings me to my next question. What is gum disease or periodontal disease? Well, it is inflammation, bleeding, and possibly slight recession. This is represented in tooth number 2 as gingivitis. Many things can influence gingivitis, such as side effects from medications or poor oral hygiene habits. Plaque accumulates on the tooth surface, which can cause the gums to become inflamed. Gingivitis can be prevented and treated by implementing good oral hygiene habits, such as flossing and brushing every day, twice a day, for 2 minutes at a time. If gingivitis is left untreated, though, it can progress to periodontal disease, where the inner layer of the gum and bone pull away from the tooth and pockets are formed, which is the numbers that we read to you in clinic. This is represented in tooth pictures 3 and 4. The open pockets around the teeth allow for debris and bacteria to accumulate, which only progress the disease and can eventually lead to tooth loss. Currently, you are in stage 3. Another thing, what is tooth decay, or better known as cavities? Well, it is when bacteria produce acids that break down enamel, the outer layer of your tooth. The bacteria ferment the sugars in the food that you eat and cause demineralization. Number 1 in the picture over here. The good thing is that you can prevent this process of demineralization and sometimes reverse it. You just need to brush 2 times a day for 2 minutes at a time. As you can see here with number 1, I had a cavity that is just at the very edge of the enamel. This can probably be remineralized. However, the last tooth illustrates what happens when a cavity is left untreated for too long. When a cavity extends into the dentin, which is the second layer of the tooth, it can lead to sometimes needing a root canal. Sounds scary, right? It's okay though, don't be scared. We're going to go over some ways you can help to prevent a cavity from worsening or get them in the first place. So, just how do we remove the plaque biofilm? Well, a few methods you can try is incorporating fluoridated products in your routine, such as toothpaste or mouthwash, which you already do anyway. An electric toothbrush can help, which you do as well. The extra fluoride remineralizes or builds up the teeth that have been affected by decay and strengthens your teeth to make them less susceptible in the future. You can also try and cut down on the number of snacks that you eat throughout the day that have high sugar intakes. And if you do, just make sure you rinse your mouth after with water. Alright, now let's go over the recommendations I have for you. Based on the clinical findings that we discussed earlier throughout this slide and also in clinic, I found that you were missing some areas in the lower fronts of your teeth brushing. Therefore, I'd like to just review the electric toothbrush and your oral hygiene routine. 1, we need to get you in the dentist every 6 months at least. 2, with your electric toothbrush, it is great for plaque removal and gingivitis. We just need to modify a technique a little bit. So, while you're brushing twice a day for 2 minutes, you want to angle the toothbrush head at 45 degrees, as you can see here in this picture, creating a triangle with your tooth and your toothbrush. Then just guide the toothbrush along the gum line, and the toothbrush should do the work from there. Alright, so overall, we learned that plaque biofilm can cause cavities and eventually lead to periodontal disease, which is where you're at right now. However, it can be arrested if we choose to brush 2 times a day for 2 minutes. Make sure that we remove our plaque biofilm and strengthen our teeth by angling the toothbrush head at 45 degrees and letting the toothbrush do the work. Don't forget to floss and continue to use your mouthwash to get into those hard reach areas as well. Lastly, I want you to keep in mind that this is a work in progress, and every day you follow through with a regimen, you are one step closer to a happier, healthier mouth. If you have any questions or would like to know more information on some of the points that I touched in this PowerPoint slide, you can click on the references here. Lastly, thank you so much for agreeing to be my test case and for coming in and helping me out in clinic. I really, really appreciate it. If you have any questions or comments, please feel free to contact me at the email address here.